Hello and welcome. Today we're diving into a common yet impactful urinary system condition, bladder outlet obstruction or BOO. We'll explore what it is, why it happens, and how it affects the body. By the end of this video, you'll have a solid understanding of BOO, its symptoms, diagnosis, treatment, and more. So, what causes bladder outlet obstruction? The most common culprit, especially in older men, is benign prostatic hyperplasia or BPH. This is a non-cancerous enlargement of the prostate gland which can compress the urethra and restrict urine flow. Other causes include prostate cancer, urethral strictures, a narrowing of the urethra due to scarring bladder neck contracture, which can occur after surgery, and less commonly, bladder stones or tumors obstructing the bladder outlet. Neurological conditions can also contribute by affecting the muscles that control bladder emptying. To understand BOO, let's look at the pathophysiology. When the bladder outlet is blocked, the bladder has to work much harder to push urine through the restricted passage. This increased effort causes the bladder muscles to thicken and become stronger, a process known as hypertrophy. Initially, this helps to overcome the obstruction. However, over time, the bladder muscle can become fatigued and less efficient. The increased pressure can also back up into the kidneys, potentially leading to hydronephrosis, which is swelling of the kidneys due to urine buildup, and eventually kidney damage. Regarding epidemiology, BOO predominantly affects older men, with the incidence rising significantly after age 50. Benign prostatic hyperplasia is the leading cause in this demographic. While BOO is less common in women, it can occur due to conditions like urethral strictures, pelvic organ prolapse, or complications from surgery. The overall prevalence of BOO increases with age in both sexes. The signs and symptoms of BOO can vary depending on the severity of the obstruction. Common symptoms include hesitancy or difficulty starting urination, a weak urine stream, straining to urinate, frequency, which is needing to urinate often, urgency, a sudden and compelling need to urinate, nocturia or waking up at night to urinate, and dribbling after urination. In severe cases, BOO can lead to complete urinary retention, which is the inability to pass any urine at all. These symptoms significantly impact a person's quality of life. Diagnosing BOO typically involves a thorough medical history, physical examination, and several diagnostic tests. A digital rectal exam, or DRE, allows the doctor to assess the size and consistency of the prostate gland. A urine test, or urinalysis, can help rule out infection or other abnormalities. A post-void residual measurement determines the amount of urine left in the bladder after urination. Uroflowmetry measures the speed and volume of urine flow. Cystoscopy involves inserting a thin, flexible tube with a camera into the urethra to visualize the bladder and urethra. And finally, urodynamic studies can assess bladder function and pressure during urination. While bladder outlet obstruction isn't usually categorized into distinct types, it's important to classify the underlying causes. As mentioned earlier, it can stem from BPH, urethral strictures, bladder neck contracture, prostate cancer, or neurological conditions. Identifying the specific cause is crucial for determining the most appropriate treatment strategy. Treatment and management of BOO depends on the underlying cause and the severity of symptoms. For BPH-related BOO, medications like alpha blockers can relax the muscles in the prostate and bladder neck, improving urine flow. 5-alpha reductase inhibitors can shrink the prostate gland over time. Minimally invasive procedures, such as transurethral resection of the prostate, or TURP, are available to remove excess prostate tissue. In cases of urethral strictures, dilation or surgical reconstruction may be necessary. For bladder neck contracture, incision or surgical repair may be needed. Urinary catheters can provide temporary relief for urinary retention. Preventing BOO can be challenging as some causes like BPH are age-related. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and adequate fluid intake, can contribute to overall urinary health. Avoiding excessive caffeine and alcohol consumption may also help. Early detection and management of underlying conditions like diabetes and neurological disorders are also important. The prognosis for BOO varies depending on the cause and the effectiveness of treatment. With appropriate management, many individuals experience significant symptom relief and improved quality of life. Untreated BOO can lead to serious complications, including urinary tract infections, bladder stones, kidney damage, and even kidney failure. Recent research focuses on developing less invasive surgical techniques and more targeted drug therapies to minimize side effects and improve outcomes. Ongoing studies are also exploring the potential role of lifestyle modifications and dietary supplements in managing BPH and preventing BOO. Thanks for watching.